Hi everyone. Where is the clicker? Hi. My name is Maxim Holin. We are Gero. We are preclinical stage drug discovery company. The cool thing about us that we use physics to model aging. Nobody did it before. We partner with big pharma like Chugai, part of Roche Group, and also Pfizer, based on our understanding of aging. So we partially rejuvenated mice, made several cool papers. My co-founder is very well-cited physicist and founding father of new scientific field, Gero physics, currently recognized by Nature magazine. So I will try to tell you very quickly what we learned about aging and how we going to stop it. So this is one of the most scariest graphs you can see in your life. Our probability of dying doubles every 8 years, and aging is behind this process. Our journey to aging, we switched from traditional biotech to longevity biotech, began when we learned about this guy. This is naked mole rat, and his probability of dying looks like not increasing, and this is incredible. He lives roughly 10 times longer than rodents of this size, and we are happy that it is not our observation. Google's company, Calica, headed by the current chairman of Apple, Arthur Levinson, the individual who sold previously Genentech for $50 billion to Roche. This company published the paper, two papers separated by 5 years, actually saying that they don't see the increase in mortality for these guys for 40 years. We believe this is the most important observation in the current biology. So the growing evidence is coming that this guy is not alone. Many other creatures, very different, which is inspirational, very different, like lobsters, some whales, some bats, also don't show the increase in mortality. So aging is bad in every possible way, but it is also the biggest business opportunity, I would say. You saw that Ozempic, targeting only one age-related condition and extending lifespan roughly for 2 years, brought about $500 billion in market value for Novo Nordisk. The conservative estimates for the drug against aging is 200 billion revenues per year. We are targeting that, and the race is underway. You see several companies already competing on it. This is news about how we do it together with Chugai, part of the Roche Group. And I will tell you how exactly we do it. When a physicist is looking into the aging data, for him aging is the question of stability and instability. Organism is stable if it fixes damage faster than that accumulates damage, and if damage accumulates faster and amplifies, the organism is unstable. In these terms, naked moles are stable, they control damage, and mice are unstable, they live very short life and die very fast. So the question is who we are. Like we are naked mole rats, we are mice, we are in between. The question is a little bit complicated. We are both. We understood that most of the human aging is driven by the entropy, by the accumulation of random damage in all levels of our organism. This damage undermines our ability to recover. This is one of the most famous our papers. second most downloaded in Nature Communications, Life Science 2021, we understood that all parameters of our body, like blood tests, heart rate, everything, it goes up and down. And because of this damage, it needs more and more time to bounce back into the norm. When we are young, we can party and go on Monday in classes, okay? When we getting older, we need more time to recover. And once we reach 120 something, the recovery times becomes infinite, and we cannot recover from every first disease that we met. The first time in the human history, we understood why exactly we have this limit of our ultimate lifespan, and what we can do about it. So we made several other papers. We believe that most of the human aging is irreversible, and based on that, we made a deal with Pfizer. I tell you about it a little bit later. We also rejuvenated mice partially with a single shot, but we understand limits of this rejuvenation. Our belief, our findings, is that aging can be radically slowed down and even stopped, but attempt to reverse aging totally, to make like 20 years old person out of 80 years old person, will face the level of complexity of attempt to unboil the boiled fish. This is the level of complexity. We believe it's much more reasonable to add some ice into the boiling water and keep fish alive. So nature shows us examples that it's happened, and physics allows us to do that. We see the industry like this. We see that age-related diseases and aging are two separate processes that should be targeted differently. Most of the industry goes there. It's about giving 10, 15 years of extra lifespan and targeting a bunch of the diseases. It's huge. We are also doing that. Our deal with Chugai is based on this. We have another one preclinical asset here, but the true radical life extension is there. It's targeting this accumulation of damage and targeting the loss of resilience. We built the huge model of health from our access to 100 million electronic medical records. We took 10 of them, which are super good, and built the model which predicts the next few years of the electronic medical records. Like Google is predicting next few words in the sentence when you write a Gmail, we do the same for your health. And we filter out irreversible part, which is aging, and only cool targets remaining, which can be targeted for age-related diseases. And actually, this is our basis of our collaborations with pharmaceutical company. But back to aging, we understood that there are three separate processes under the single brand of aging. One is reversible, giving up to 10, 15 years. We did it with Chugai and have another one. Number two is when our parameters fluctuate, like blood tests and everything, and these fluctuations increase, we can call it also noise. We found the way to pharmaceutically reduce this noise, and thus we will make people live up to 100 plus without the diseases. We found targets, we found biomarkers, we found several molecules, demonstrated it on the model organisms. Everything works exactly as predicted by physics. If physics is wrong, we have the problems of other level. And number three, drug is something that happened with naked mole rats and other guys. It's about radically stopping aging or slowing it down. We have targets. We are now working on biomarkers because biomarkers are crucial. Otherwise, it is the most boring drug you can imagine. You get the pill, and we promise that nothing happens to you for the decades, which is like cool, but very hard to prove and to sell. So biomarkers are crucial stuff. This is our pipeline. The business model is very well validated. Technology-based companies are cooking their own therapies, and at some point out-license it to part of them to pharmaceutical companies, and part of them are being developed further. So our portfolio combines moonshots to aging together with the lower risks assets targeted to age-related diseases based on our insights into aging. So it's a well-balanced portfolio. This is our deal with Shugai based on our understanding on aging. Like we have multi-million upfront, 250 million milestones and royalties from worldwide sales. Nasdaq congratulated us and we hope we meet one day with Nasdaq. But the main thing, it's not like just milestone for us and the whole longevity industry. It's also the next level of validation of the very same technology that we use to find the drugs to stop aging. This is the most important part. So now we focus on aging number 2 to reduce the noise. The best models for them are dogs. For dogs, the environment became awesome just last year. FDA allowed to sell anti-aging dog drugs if you show your candidate is safe and you show some historical evidence why you think it will be working. So it saves a lot of years and money. Since it's in line with our strategy to go to humans through dogs, it also gives us opportunity to jump into the market fast. So this is our vision how the future will look like when aging will be stopped for people between 20 and 30, the life expectancy is much bigger than 100 years. For older individuals, we believe in partial rejuvenation, 10-15 years maximum, and stopping aging after that. And this is the ultimate preventive drug that you can imagine. This is our team. Petr Fedichev, physicist behind all this, worked with the Nobel Prize winners to model universe, several drug hunters from Pfizer and other big companies, and several AI guys with exits to Google and to Facebook. They understand the AI part of our project. This is our financials expectations, few dozens in nearest years from pharmaceutical deals, and once we tap into the dog aging market, it's hundreds of millions, but we believe we are category defining biotech for multi-trillion dollars longevity market because like nobody stops aging yet. This is Gero physics, something that started as our in-house exercise to apply physics to model biology, now recognized by Nature magazine as a separate field of science. Join us in our fight. This is the coolest thing that we can do, like civilization scale impact. It's about people we love, it's about ourselves, the biggest business opportunity. I don't know what to say, next step in evolution. Choose what you like.
Thank you very much, Max. Thank you. You can build a football team with your list of advisors. I love that. Do we have a question for Max before he heads off? Let's go for this gentleman here.
If I understand well, so you take one pill and you are good for few years or
It's
or more.
one of the options because since there are three components of aging, it all depends. For like older guys, we should combine all three, and they have different regimen, like we think about it ourselves.
But anyway, you are not talking about something which we are taking every day. We are taking from time to time.
For number one, it can be our drug was supposed to be administered once per year, and for stopping aging, it really can be the gene therapy which will stop it, but we are not sure. We have several options now on the table. This is the most like underdeveloped number three part. So
okay, thank you.
And
Thank
Stefan
you
has a question as well, just and then we'll wrap things up.
Thank you, Maxime. What is effective temperature?
sorry?
Effective temperature?
Effective temperature, this is something we fight with my partner who is physicist. Actually, it is the size of the noise. But since he is from physics, he wants to use the like very like exact definition. It has nothing to do with the temperature of the body. It's about noise, the size of the noise. So how big are these fluctuations of all our parameters, like C-reactive protein, whatever? It fluctuates, and if it fluctuates a lot, it means the temperature is bigger.
Okay, so the parallel is temperature in a molecule. I understood like what it is physically.
Yeah.
Maybe it's like if biomarkers go up and down a lot, that's effective temperatures higher.
Yeah.
Variability in certain biomarkers.
Yeah, in certain, almost in all.
I'll leave you guys to discuss that later, but another round of applause for Max.